Good morning, everyone. Welcome to Carrie Carroll's Healthcare Update Show. Today's topic of discussion will be nurse practitioners. What is the role of the nurse practitioner? The education and certification for nurse practitioners to practice in your area. What's the scope of nurse practitioners in the state of Alabama? And last, where can you find a nurse practitioner? What kind of settings are they working in? So let's get started. First, what is a nurse practitioner? Nurse practitioners are advanced practice nurses educated and trained to work independently and collaboratively in a variety of healthcare settings, providing care focusing on health promotion, disease prevention, education, and counseling. They are known to provide care to the majority of the elderly, poor, and ethnically diverse populations in primary care settings where access to care is just extremely limited. Nurse practitioners provide high-quality patient care. They provide affordable, cost-effective care to individuals of all ages and populations. So next, let's talk about the role of a nurse practitioner. So dating back to the 1960s, nurse practitioners were developed to bridge the gap between the growing healthcare need and the scarce number of primary care doctors in primary care settings in the United States. Nurse practitioners can evaluate, order, interpret, diagnose, and treat, manage acute and chronic health conditions, and prescribe pharmacological and non-pharmacological medications and therapies to individuals of all ages. They exhibit 5 core role functions, such as the teacher and educator, advocate and consultant, manager and leader, researcher, and expert clinician. Nurse practitioners are expert at teaching and counseling individuals of all ages about illness prevention strategies, treatment options, medications and management of medications, and how to provide self-care and the importance of follow-up care. Nurse practitioners' role is to ensure the continuity of care to all of their patients, decrease their healthcare costs, and optimize their outcomes. So you ask, what is nurse practitioners' education's background and certification that is required for them to practice? Well, first of all, nurse practitioners are required to have a bachelor's degree in nursing. They are required to keep an active registered nurse license. They either receive a master's degree of nursing or doctor of nursing practice, focusing on advanced preparation in specialty area of population focus. They receive advanced education and skills in leadership, health policy, evidence-based practice, including 3 core competencies of advanced physiology, advanced pathophysiology, advanced health assessment, and advanced pharmacology. Nurse practitioners are required to complete an average of 720 clinical practice hours in family and individuals across the lifespan. This includes adult gerontology, neonates, pediatrics, women's health, and psychiatric mental health. Once nurse practitioner students complete their course requirements, they can sit for either one of the 2 national board certifications, either the American Nurse Credentialing Center, known as the ANCC, or the American Association of Nurse Practitioners, known as the AANP. Once the nurse practitioners pass one of the certification exams, they can practice within that state. So let's talk about these scopes of practice. Here is just an overview of the United States, and it shows the different scopes of practice from full to restricted in which nurse practitioners can practice. So, nurse practitioners' scope of practice is regulated by the state in which they work in. For Alabama, this was termed reduced practice. This requires a collaborative practice agreement with a physician in the practice area of the physician and nurse practitioner's population focus. The nurse practitioner receives oversight and direction required by the rules and regulations of the State Board of Medical Examiners and the Board of Nursing for that state. Nurse practitioners, however, do not require direct on-site supervision by their collaborating physician, but they do require that physician to spend a minimum of 10% of their scheduled hours within that clinic. Nurse practitioners have the authority to prescribe medications, as long as they are authorized and approved through the protocol signed with their collaborating physician. They also have the authority to prescribe Schedule 3, 4, and 5 controlled substances in the state of Alabama. So for the scope of practice in Alabama, nurse practitioners have core skills that they can perform. These include admissions, transfers, discharges, order and interpret labs, diagnostics, and radiology, plan and initiate therapeutic regimens including medical devices, nutrition, and supportive services, as well as initiate referrals. So you ask, where can I find a nurse practitioner? Where are they located? So some practice settings in which nurse practitioners practice include hospitals, residential care facilities, state or local health departments, schools, acute care facilities such as emergency rooms or urgent cares, private physician offices, and primary health care offices, just to name a few. So, before we conclude today's show, let's talk about 3 main takeaways I want to leave you with on why to choose a nurse practitioner. First, nurse practitioners provide affordable, cost-effective care. This is so important in today's time. And second, they provide high-quality care, focusing on your health promotion, disease prevention, educating their patients, and counseling their patients. And last, nurse practitioners offer increased access to primary health care. This is so important for the rural and underserved aging populations to help decrease the risk of morbidity and mortality. Well, here are my references, and I hope you tune in to next week's show on your healthcare update. Have a good day.